Any good psychotherapist will tell you that people come in and then people got problems, and life definitely isn't easy. And you can tell the quality of treatment between people who immediately want to just diagnose something's wrong with the individual, as opposed to a more seasoned view of psychotherapy is, well, first assessing the environment. A lot of times, life is difficult. It's not necessarily because someone has a diagnosis or there's something necessarily wrong with their history, but life is tough. A lot of the things that people get hit with, well, it just makes a lot of sense why they're having the problems they are. If you have a couple who they're fighting like cats and dogs, you just can't get them to stop. Well, maybe there's a psychological problem, but chances are what's more likely is there's something wrong in their environment. Maybe one parent, one spouse, for whatever reason, isn't working, and income's tight. Well, a good environmental change there would try and help both people get part-time or full-time employment. And oftentimes we'll sort things out. The stress of poverty, that's severe. It's not abnormal to be stressed out because you don't have money. Or things, feeling depressed is another really good example. Recently, there have been advances in behavioral approaches to depression, where the therapist is not really addressing, well, how do you feel? The therapist is not really addressing what the internal thoughts are, or the history of the person really is. Really, what these sort of therapies do, and some of the research here really blows CBT out of the water and medication use by a lot, is to simply kind of look at the person's environment. How is your day structured? What do you do? And a lot of times people, the way depression starts is, well, something happened, the first domino falls. And it could be something as tragic as, someone in the family dying. I mean, that's tough. Or, losing their job. But it could also equally be likely something positive happened. Something that floored me was, research showing that, there's a fair chance of developing some level of depression when you get a promotion in your work. And you kind of think, well, why would that be? And when you start thinking about it, it kind of makes sense a little bit. True, like you're getting a pay raise, you're getting moved up to the top office, but well, at the same time, you're losing your social network, people that you've been working with for years. They're staying downstairs. You're moving into a job that you know little or nothing about. Are you going to make it? Are you going to be competent? And people have a negative thought bias where we're a lot more sensitive to danger than we are success. So that also gets factored in to getting this new job. And maybe you might even lose a couple friends, either because you find out that they're bitter at your success, or they're boiling because of their failures. Either way, they can't look at you the same way. So even in something as positive as a promotion, there's a cost to success, I guess, is one way of thinking about it. So what you do is, well, you just almost kind of reconstruct a person's environment. Get them out of bed, get them to go to the McCullough and get a can of Coke. Because what ultimately happens is, well, that one domino, that promotion or that tragedy, sets into motion almost like this positive, almost this sort of like a positive feedback loop where a person becomes more likely to disconnect from their world. So you want to reconnect them to their environment. So like I'm saying, okay, well, if those things aren't so successful, then we move on to the big guns and maybe there's something wrong with the person.